The US federal government partially shut down on Wednesday. So, what's at stake for healthcare? Let's talk about it.
The federal government ends its fiscal year on September 30th, and it's Congress's job to pass spending bills before the new fiscal year starts on October 1. But most years recently, including this year, Congress didn't meet that deadline. And so it usually passes a continuing resolution that authorizes the government to keep spending money at current levels until the new spending bills are passed. Often, the continuing resolution is what's called a, quote, clean bill with no additional amendments. But this year, Senate Democrats wouldn't agree to a clean bill because they wanted Congress to address some big health care issues. So the continuing resolution failed, and the government had to partially shut down because, with a few exceptions, there's no money to continue operating.
What healthcare issues are the Democrats pushing for?
The Democrats have two demands. One is that Congress extends subsidies for lower income enrollees in health insurance plans bought through the Affordable Care Act's marketplaces. The subsidies end later this year, and without them, many people will see their premiums spike, and some may have to drop coverage altogether. The second thing they want is for Congress to restore the nearly $1 trillion in Medicaid cuts that were passed earlier this year.
And how is the healthcare sector affected by a shutdown like this?
Well, it's a mixed bag. Medicare and Medicaid will continue paying doctors, but routine events like healthcare facility recertification surveys will stop, and the NIH's clinical center will stop admitting new patients.
Well, what happens next?
Good question. Well, things are at a standstill for now, although there are likely some backroom conversations going on at the Capitol. There has been at least one attempt in the Senate since the shutdown to pass the continuing resolution, but that has failed, and the House isn't scheduled to come back until next week. We will probably have to wait until then to see who folds first. Of course, things could change at any minute.